Hello, my peeps. It's Monica, also known as Sleeved Over 60, and today is Friday, October 14th, 2016, and I'm coming to you from the Twin Cities on a beautiful, I'm looking outside on a beautiful fall day. First of all, stats. I'm 63 years old. I am almost 5'5", and although I don't weigh myself very often, I have made a commitment to weigh myself once a week. And today I am 221.5 pounds. So I lost 2 pounds since the last time I saw you last Friday. I think that one of the reasons is that, as I mentioned last time, I went on anti-anxiety medication, and certainly that has helped with the anxiety, which of course then helps with binge eating. Still just, hanging on, waiting. My next appointment with my nutritionist is on November 28th, and then with the psychologist is December 19th. So we'll see what happens after that. So the thing that I wanted to talk about today is one of the things that I'm dealing with, and I'm trying really hard to deal with in therapy, is the whole idea of worthlessness or worthiness. We all know about worthlessness, unfortunately. And am I worthy? Am I worthy of having this surgery, which will hopefully help with such a cross that I've had to bear in my whole life, when you really think about it, 50 years of dieting. And I talk about this a lot with my therapist because it's such I think, a huge issue that makes me and a lot of us sort of fail at, whether it be, my word is recovery. And again, listen, I'm not a doctor. I am not, anyone's therapist. I'm just using my terminology. So I like to think of it as recovery and not being on a diet or, just not having my relationship with food not being out of control, and that to me is recovery. So one of the issues about this, am I worthy, is that, as I've mentioned in my videos before, back in the 1st of April of 2016, I went to talk to my doctor about weight loss. Not surgery, just weight loss, because I felt that I'm having some medical issues, and that losing weight would be something that would be helpful to me. And that at this point in my treatment, I went to eating disorder treatment, to binge eating disorder, about 8 years ago, and I thought that my relationship with food was much healthier, and that this would be the perfect time to do something about my weight. So it would have to be restrictive, so I would go on a diet. I would have restrictive eating, which I haven't done in the last 8 years. And interestingly enough, I've, gained and lost a few pounds, but it hasn't, most people that I met going through eating disorder treatment, most of us were just deathly afraid that what do you mean, if I don't diet, I'm going to balloon, and to whatever, the fear of our weight was, and none of us did. But anyway, so when my doctor or the bariatric clinic, when they talked to me about bariatric surgery being a tool and an option, and that I would most likely qualify as far as having my insurance pay for it. I was pretty surprised because that's not what I went there for. And surprised because in years past, I did go and look at that option, and I never qualified. So what made it now? Well, what made it now was that I have sleep apnea and pre-diabetic and all of those things. So it wasn't necessarily my weight, but it was the other comorbidity, something like, you know what I'm saying. I don't know why I can't think of that word, comorbidity issues. But anyway, so that's why I qualified. Well, much to my chagrin, because in the past, you know, how could that have been when I really wanted it, and I thought probably needed it more than now. That wasn't a resource, and why was it now? So I have been really dealing in the last 6 months with this whole idea of, am I worth it? And I have to admit that there have been times in my life when I thought, oh my, if I didn't have this issue, then what would become of my life, sort of. Not that I would be perfect, but that something like, you know, what would my life be like? What would I have time for if I didn't have to obsess about my weight? Because for many, many, many years, thoughts about what I ate and how it was going to be good the next day just really overtook most of my thinking. So it was one of those things that, aside from, you know, wishing and caring that my child would be safe, I think that I spent most of my wishes or prayers on my eating disorder and on my dieting, and please, you know, let me work on this tomorrow. Which, when you think about it, what would I be doing today if I didn't spend all that time on that issue? So I have to, you know, think about it now. It's like this has always been the last frontier for me. So if for once I take care of my eating disorder and it goes into recovery or remission, what will become of me? You know, how will I be able to live from day to day? What will my thoughts be about, and my worries and my concerns? Because, you know, I think that I've always kind of prided myself in the fact that I've really created a good life for me. I've made some really good decisions throughout my life, and some good things came to me. So this was my biggest struggle. So if this isn't a struggle anymore, then what? What happens? One of the reasons why I decided to look into losing weight at age 63 is because my grandmother died at 102. So I figured I have another 40 years to live. And I want to be healthy, and I want to be, you know, productive as I get into my 70s, 80s, and 90s. And I knew that I needed to do that at a very healthy weight. So if, in fact, this surgery, and I know that a lot of you talk about, is this true? It did work for me. So I wonder if some of you will indulge me in just thinking about it, when you're worried about it, if it's not similar to what I'm talking about. This whole idea that if this works for me, and if in fact weight and dieting and restriction is just going to be, you know, another everyday thing that I'm not going to have to struggle, then what will my life be like? And in fact, do I, am I worthy? Do I deserve this? Do I deserve to have other issues to worry about? I cleaned out some of my closets. The last couple of weeks I had some, closet designer kind of thing done in one of my rooms. So I started to get rid of my work clothes. And I had from size 4 to 14W, a lot of work clothes. Part of my job, I often had to go to court. So I had, some appropriate business wear, and I took it to a place called Dress for Success. And as I was driving off, I thought about how I had a job and a profession that I didn't really have to worry about having a job. So that kind of fit into what I'm talking about now, because this whole idea of, okay then, now what? I remember from the time that I was a teenager, that was one of the things that I would often cry about, and make promises and, make deals with God or the devil, I don't know which one, about not having to worry about my weight or not having to diet. And that's, who knows, 80 pounds ago. So that's what I'm thinking about this coming week. I'm going to try really hard to just kind of concentrate on, am I worthy of having this? And I ask that you join in thinking about that and share with me. I'd love to hear from all of you. And, I think that as an older woman in this community, that what a gift to give to the younger women, to share this when it's been a lifelong struggle. So that's where I'm going to leave everyone for the week. Sending really good thoughts to those of you who had surgery this week. I'm trying not to use people's names because I don't know how they feel about their confidentiality and their privacy. But anyway, so see you next week. Besos. Thank you so much, everyone, for your kindness and thoughts. Bye-bye.